Hello and welcome to this video on bruises. These are the things that develop when you get in a fight, have an accident, or engage in aggressive sports. The question is not so much as what the effect observed is, but what a bruise is. To give its proper term, a bruise is a contusion, and it's the skin discoloration when your tissue is injured, primarily from damaging blood vessels underneath the skin. This lets blood leak out, and what you observe is pooled blood. There are several different categories of bruise: hematoma, purpura, petechiae, and senile purpura. Hematomas are effectively when you experience blunt force trauma, and this causes that damage to occur. The blood pools in the area around the damaged blood vessels, causing pain and swelling. Purpura are just like this, except they are substantially smaller. Petechiae are even smaller versions of this again, generally less than a couple of millimeters, or tenths of an inch. Senile purpura is a specialized category of purpura, and it is specific to those who are older because their skin is thinner and more prone to damage. This means they more easily develop bruises. You can think of these as the types of bruises themselves, and primarily we've so far attributed them to outside forces coming into play on the body. Consider what would happen if you had to come to a sudden halt in a car accident, whether that is the seatbelt pulling tightly on you, an airbag going off and hitting your face. All of these create a sort of blunt force trauma to the body, and that causes small blood vessels to break and release blood. That's the bruise. There are other ways this can occur, and these ways can be seen as intrinsic to the body. Things like thrombocytopenia. This is a low platelet count. That means your blood can't clot. And if it can't clot, you will have blood leaking out of various parts inside of you, primarily those same small blood vessels that cause bruising. When it's close to the surface of the body, that's exactly how it appears, a bruise. The next is somewhat related to thrombocytopenia, and it's leukemias. Leukemias are important in that they affect the bone marrow by effectively outpopulating the other cells with immature cells that can't produce functional leukocytes for the immune system, red blood cells for movement of oxygen, or, importantly here, platelets. The lack of these various kinds of myeloid-derived cells is going to cause issues to do with how the contents of the blood, primarily plasma, but also other contents, leak out of the blood vessels and begin pooling in the tissue around them. This causes what is functionally the equivalent of a bruise. It then leads to the increased edema in the area. Edema leads to swelling and can be seen as a sort of kind of bruising. If you begin to see the red blood cells being forced out through the same process, that's where things like petechiae come in. It's especially notable in areas where lymph nodes can be found where they become swollen. You can find that various organs become enlarged because of this. It also increases the chances of blood vessels becoming damaged and cause more obvious and normal bruising. The final intrinsic pathway we're going to mention is hemophilia. Hemophilia being an inherited disorder, and what happens here is that the body can't produce the required factors, or in other cases, certain cofactors required for the clotting cascade to occur. No clotting cascade means that ruptured blood vessels can't be sealed, and if they're not sealed, blood will continue to leak out until either enough red blood cells pile up in the area to be able to forcibly close it, or something similar happens. While that's one option, that damage can cause blood to leak out continuously, it can also lead to spontaneous bleeding. Again, without platelets to try and block these damaged sites. The blood is thinner, and if there's any kind of opportunity for it to get out, it will take that. Hemophilia is an inherited disorder, and fundamentally nothing can be done about it other than to give the person who has it platelets and platelet cofactors. once a bruise has occurred, the body's means of getting rid of it are slow but certain. The necessary macrophages and monocytes will move into the site. As they move from the bloodstream into the local tissue, they will begin to clean up the leaked out red blood cells and other blood material. It will package this up inside the cell and take it back to the nodes and eventually the spleen, where it will be recycled and the material that it can be salvaged will be salvaged. This process will continue until the immune cells gather up all the residual amounts of blood that have led to the bruise. This is why you will see a change in colour, from a very dark initial black coloration, which is the blood as it's begun to coagulate, through to something more pale. That pale coloration is because it is literally being taken away and thinned out in that site. It's why gradually you will see the bruise begins to subside. Material is physically being removed. The damage to the blood vessel is also being repaired at the same time. This means edema into the site, or fluid leaking out of the blood vessels, moves back into those blood vessels and is carried away until the tissue site goes back to its normal state. This, of course, assumes that the person is in an otherwise healthy condition. Very young individuals, such as newborns, may not have the necessary cofactors such as vitamin K to be able to stop bleeding. This is why infants are given a vitamin K shot right after birth. The elderly, on the other hand, may not have a body in healthy enough condition to be able to repair the damage as it has occurred. This is one reason why they are more prone to bruising and it lasts much longer. While this is a very brief overview of what a bruise is, the possible causes, and how it's dealt with, hopefully you found it interesting. Thank you for watching this video. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below.